Hi. You ever had that experience where you've had something that was a small problem that you ignored that became a bigger problem until it became a costly repair? Well, that's what we're here to talk to you about today. Hi, I'm Dr. John Gray, and I'm here with John R. Gray Chiropractic Center, and we're here today to talk about a free way that you can uh, avoid that kind of scenario for yourself. What am I talking about? I'm talking about scoliosis. So we have a new scoliosis screening we're doing this week, and the reason why we're doing it, and the reason why we're doing it free, is because it makes such a big difference, especially to kids, if we can see it early on and we can help them manage it. What is scoliosis? Scoliosis is simply a curvature of the spine, um, and there's four types. If you depending on which type you have, will depend on what your outcome is. So, what are the four types? The four types of scoliosis are congenital, something you're born with essentially. Something's not formed right. You were just you were born that way to some degree, and you have to learn how to cope with it to make it work better for you. There's idiopathic, which is the bulk of the scoliosis out there, which is great because there's not a lot of things that are set in play that prevent us from helping it. The next part is structural, or what we like to call degenerative. Those are things because of accidents or because of traumas. Um, Things are not shaped the way they used to be shaped. Or because you had something happen and it gradually was ignored, then that area wore in a certain way that's now causing you the curvature in your back. And the last one is neuromuscular, and that's the most difficult one. Neuromuscular, a lot of times, has things like cerebral palsy or some other types of neurological condition that's behind it. Now they still need help, and I'll tell you why here in a minute. So what can we do for scoliosis patients? Well, in a nutshell, when you get the curvature, it makes your back less efficient and makes you work harder. Also, if your posture isn't as good, that'll make you work harder as well. What does that mean? That causes the disease to progress faster. And essentially, the risk of the disease, especially for a young person, is one, they can develop it on their developing bones, so that is more misshaped than we like it to be, or than it has to be. And then they have to live with that with the rest of their life. The second problem is as that curvature gets bigger, it's just the same length no matter what. So as it starts traveling out here, the head and the butt basically come closer together. What's that mean? That means you have less space to breathe and less place for your heart to work. And that can become a problem for severe cases. So the best way to find out, and I know they do screening at schools, but we do a little more thorough screening, and we're trained to catch other nuances of why you might be having it. It could be stemming from different ways that you might not even be aware of. A faulty foot or something of that nature that's causing some of that scoliosis. So what we do is we do a simple free evaluation. And we're doing it on Wednesdays. We're blocking out a time this month, and for you or your kids. And this is really to help kids at this point. So we're going to cut it off at 18. So anybody that is 18 or younger that would like to be checked out, usually we like to look at them around 8 years of age, 6 years of age at the youngest usually. That way we get an idea of what's starting to go on. So bring them in, and we'll take a look at them. We also will do a quick screening of an X-ray, and that's the best way to measure how aggressive that curvature is. And depending on the aggressiveness of it, we may recommend nothing. If there's nothing there, we'll say you're in the free and the clear. And if there's a little bit of something there that we need to keep an eye on, we might say we need to follow up with that in 6 months or in a year, and just to make sure that that's not progressing. And then, of course, we would give you some input and ideas of how you can help diminish that curvature in your child's life. So I hope this helps. I just wanted to send this out to you guys, and hope this wasn't too long, but just call in 208-854-0600. Again, that number 208-854-0600, and schedule your child today. We're gonna have about 4 Wednesdays that we're doing it on. Okay, so and we'll hopefully be able to fit you guys into one of those. And You can get ahead of that problem and so that it doesn't become a bigger problem.